Hi, Dr. Henry and Minister Dix. Hoping to ask you today more about the vaccine distribution and whether or not you've encountered any problems with doses having to be wasted yet because they're not handled properly. And in some COVID-free zones, I'm also hearing from people complaining about still being confined to their rooms since November when they're not anywhere near being exposed to it. So mainly just, have you encountered any problems with vaccine doses being wasted?
No, and so far so good. We put a lot of time and effort into making sure we had people trained, that we had the infrastructure in place, and we talk about over the Christmas weekend not putting enough doses in people, but part of that was making sure we had the right equipment to be able to safely move vaccine, and the right vaccine to be able to do that, and that people knew how to handle it, because as I've said a number of times, there's a lot of fussiness about making sure the vaccine is stable. So no, as far as that is one of the things that we monitor quite carefully, vaccine wastage. We have not had any serious concerns with vaccine wastage, and there's a process in each health authority for once the doses are coming up to the end of the 6-hour period, if there's not people there for their appointments, that we have other people who are on the priority list who are able to come in and receive the vaccine. So I've not heard of any concerns. In terms of people, it is something that of course we're watching very carefully. In terms of long-term care homes, we are still at the point of giving everybody dose 1, and it takes time for your immune system to develop enough antibody that you are protected. So it's a couple of weeks after dose 1. So we're not yet at that point where we can let up on keeping people safe distance, on wearing PPE, on reducing the numbers of people who are going into long-term care homes. But that is the future. That is what is going to happen once we have everybody protected in those communities that are most at risk. And that's our aim, priority 1 across the province.
Follow up, Marcella?
Just regarding the tools in your box right now to try to keep numbers coming down, because we have noticed that numbers have slowly kind of dropped a bit, but we're still seeing 22 people die over the weekend. So what more do you think you're prepared to do to ensure that people are following the rules when we are still seeing some people ignoring them?
Yeah, so we're obviously thinking about lots of things. We renewed our orders as of Friday and kept them the same because we know we're not out of the woods. And we saw this in October where we started to have a bit of a dip. And with cases of 500 a day, that can start to go up exponentially very quickly. So this is such a critical time. I get so challenged with it because I know how tired we are, and we hear these stories about politicians in other provinces going off on vacations and things and thinking that it's not serious enough. But we know what we need to do here in BC, and we know that we can get these down even further. We watch what's happening in Ontario and Quebec and next door, and where hospitals are getting overwhelmed again. We need to keep holding our line here in BC, and that means keeping our social gatherings small, making sure we're using all of our layers of protection in our workplaces, that we're not letting our guard down right now. Right now, of all times, we have to step it up because there is an end. And we're at that part in the marathon when we're tired and we can stumble and get injured, but we need to support each other to keep this going because there is an end. And it's part of it's because of vaccine, and part of it's because we're keeping our rates as low as we can, and that saves lives every day.